Hi, my name is Eric Quintanilla and my presentation is on pertussis. So just a quick table of contents. I'm going to first talk about the disease itself, diagnosis and treatment, and then the vaccine. So pertussis is a bacteria. It's known as Bordetella pertussis. It's a gram-negative bacteria, and here we have a picture of it. At the moment, it's only known to infect humans, but there are other species of Bordetella that are known to infect animals specifically. And there's also Bordetella pertussis, which is parapertussis, which is like pertussis, but it just produces a milder infection. And it's a toxin-mediated disease, and that's because it releases a pertussis toxin once it's inside the body, and that's what actually causes the damage to your lungs and respiratory system. If you didn't know the name pertussis, maybe you know it by its other name, which is whooping cough or the 100-day cough, and I'll explain later why it's called that. Some recent outbreaks, most recently, and actually the biggest, was in 2012. There was around 48,277 reported cases in 2012 alone. And then there was another outbreak in around 2010. And I found the reason for that outbreak to be really interesting. So we first had the DTP vaccine. So before the vaccine, it was ridiculous. There's around 200,000 cases a year in the US alone. DTP helped decrease that. Uh, but it's a wholesale vaccine, so the effects or the side effects were a little greater. So in the 90s, they switched to DTaP, which is the acellular version of the vaccine. Um, Although it has milder side effects, it's not as effective as DTP. So by the time the children that got DTaP were vaccinated, a few years down the road, they started to lose more of that protection against pertussis, and that's what led to that 2010 outbreak. And because of that, Tdap was developed. So if you notice, there's uppercase and lowercase letters. Uppercase indicates a higher dose of that portion of the vaccine. So DTaP has a higher portion of the pertussis dose, while Tdap has a lower dose of pertussis, but it still protects against pertussis. So at the moment, there's two vaccines: DTaP for infants that are 6 and younger, and then Tdap for older children, teens and adults, and pregnant women. So there's three main hallmarks of the disease. The first is apnea, which is a pause in breathing. It's one of the earlier symptoms, and that typically occurs in children and especially in babies, it's those younger kids. There's also the paroxysmal coughing, so you're going to have a lot of coughing fits, and within those fits, in the later stage symptoms, you're going to get that high pitch whoop sound, and that's why pertussis is also known as whooping cough. And then you're also going to get coughing fits, and they can last 10 weeks or more. And that's why in China it's known as the 100-day cough, because you're going to be stuck with a pertussis infection for quite a bit. Just some more symptoms, especially recognizing those symptoms in infants. Like I mentioned, there's apnea, which is that low-grade fever, or pause in breathing. Then you have low-grade fever. At the beginning, you have the minimal coughing, so it's often confused with the flu, because the first 2 weeks, which is when you're highly contagious, a lot of the symptoms are similar to those seen in the flu. You have the post-tussive vomiting, so after a lot of the vomit or coughing, you can get vomiting. Coryza, which is the inflammation of the mucous membranes around the nose. You're going to be really tired. It's a lot of exhaustion because you're going to have a lot of coughing fits. Over the night, you could have 25 to 30 coughing fits. You're also going to have the paroxysm, which is that rapid fits of coughing. And while whooping cough is pretty common, you can oftentimes not even have the whoop sound. So here I have a video of a child with pertussis, so you could hear that whoop sound. So unfortunately, pertussis really affects children and especially infants really bad. So as you saw in the video, the kid's really struggling to breathe, and when he does breathe, you get that high whoop sound, and that's the whoop sound that I mentioned earlier, which is how pertussis is also known as whooping cough. But it just really tends to be really a lot worse with children compared to adults, just because their airways and passageways aren't fully developed. The disease progression, it's around 3 stages, but it's four if you count the incubation period. And that incubation period lasts from 5 to 10 days, but it can go up to 21 days. The first stage is the clitoral stage, and it lasts around 1 to 2 weeks, and it begins in the onset of the symptoms such as the low-grade fever and the coughing. And when you're highly contagious, the first 3 weeks at the start of the paroxysmal coughing. And pertussis is a highly infectious disease. One person can infect up to 12 to 15 people. It's almost catching up to measles, which is pretty high up there as well. After that first stage, you get the paroxysmal coughing, and this is mainly where you get the coughing fits, a lot of rapid coughing, which is followed by that whoop sound that you saw in the video earlier. That stage can last from 1 to 6 weeks, so it's also a pretty long stage. And then the last stage is actually the longest, the convalescent stage. Um, at that point, you're more so dealing with the effects of the pertussis toxin rather than the bacterium itself. And you're still gonna get a little bit of coughing, not as bad as the previous stages, but it's still there. And you're also susceptible to other respiratory infections. So imagine you're already like 12 weeks in a pertussis infection, and then you get another respiratory infection on top of that. So you really don't want to get pertussis. There's two main ways to diagnose it. First, you want to get a sample, and that's either done through a nasopharyngeal swab or an aspirate. And that's basically going through the nose to swab the back of the throat. If you plan to culture it, you want to directly plate the swab and place it in the transport medium. And then ideally, you want to collect the specimen within the first 2 weeks of illness, but that can be difficult to do because it can be differentially diagnosed to other illnesses, just like the flu, because the symptoms are very similar. If you either culture it or you do a PCR test, and for that one, you ideally want to collect the specimen within the first 3 weeks, and then it's the most rapid test. The last test, the blood test, isn't the best. You're just testing for antibodies, IgA, IgG, IgM. So it's not the preferred test, but it's more of an indirect method of identifying a suspected pertussis infection. So here we have the nasopharyngeal swab, which like I said is the back of the throat, and here's the nasopharyngeal aspirate. They're pretty similar, it's just to collect the specimen. So treatment, you're going to use antibiotics, obviously, but first if you suspect that they have pertussis, you want to treat them prior to the test results. So treat them during the first 1 to 2 weeks, and that would help lessen the symptoms. From there, you prescribe antibiotics, so azithromycin, clarithromycin, or erythromycin. Any of those would work. You also want to treat the people that have been in close contact. You probably want them to quarantine if possible, and you're going to treat them with antibiotics within 3 weeks. And something I found interesting is that they recommended not to use over-the-counter medication because they said it didn't work. I'm not exactly sure why it doesn't work, but if you do have pertussis, you want to avoid over-the-counter medication. But hopefully, prognosis, it tends to be good for teenagers and adults and tends to be really bad for children and infants. So something I found interesting is that the bacterium itself dies off after 3 weeks. So everything after that is basically the effects of the pertussis toxin. So that's why after that you don't really prescribe antibiotics because they're not really going to work because the bacteria is already gone. It tends to be less severe in teens and adults, so less than 1 out of 20 adults will need treatment at a hospital. And the most common complication is weight loss. So 1 out of 3 adults will experience that. But even though it's less severe, I did see a video of this older person with pertussis, and I didn't include it because it made me feel honestly really uncomfortable just how sick he was. And it's most severe in children and infants. So one out of 2 babies younger than 1 will need treatment at a hospital. 1 out of 4 will potentially get pneumonia. 3 out of 5 children will have apnea, which is that pause in breathing, and 1 out of 100 will die. So you probably don't want to get pertussis at this point, but luckily there is a vaccine. There's two, DTaP and Tdap. DTaP is for children younger than 7 years of age. It contains a larger dose to the pertussis portion compared to Tdap, and it's recommended that children receive 5 doses total in order to get the best protection possible. There's also Tdap, which is for adolescents, adults, or pregnant women, and you should either get Tdap or TD, which is basically the same, just doesn't protect against pertussis, but it does protect against tetanus and diphtheria. And there's a booster shot that you can get every 10 years, which is Tdap. The vaccine schedule differs between the two. DTaP is recommended until the ages of 6. There's 5 total shots, so 2, 4, and 6 months, between 15 and 18 months, and the last shot is between 4 and 6, and that's to get the maximum protection if you get all 5. And that protects against tetanus, diphtheria, and pertussis. The one for older children and adults is Tdap, and that's recommended for ages 7 to 10 if you're not fully vaccinated. 11 to 18 if you had DTaP, but now you need Tdap or TD. 19 and up, there's a booster shot, which many people don't know about. It's recommended to get it every 10 years, and especially if you're working with young children or you're interacting with young children often, you really want to get that Tdap booster shot because it's often the parents or older adults that pass it on to the children who are most susceptible to a pertussis infection. And then pregnant women. So it's recommended between 27 and 36 weeks of gestation in order not only to protect the mom but also the baby. Here are my sources, and thank you for listening.